Appendicitis is a painful swelling of the appendix. The appendix is a small, thin pouch about 5–10 cm, 2–4 inches, long. It's connected to the large intestine, where stools, feces, are formed. Nobody knows exactly why we have an appendix, but removing it isn't harmful. Appendicitis typically starts with a pain in the middle of your tummy, abdomen, that may come and go. Within hours, the pain travels to the lower right-hand side, where the appendix usually lies, and becomes constant and severe. Pressing on this area, coughing, or walking may all make the pain worse. You may lose your appetite, feel sick, and occasionally experience diarrhea. What causes appendicitis? It's not exactly clear what the causes of appendicitis are. Most cases are thought to occur when something blocks the entrance of the appendix. For example, a blockage may be formed by a small piece of feces, or an upper respiratory tract infection could lead to a swollen lymph node within the wall of the bowel. This obstruction leads to the development of inflammation and swelling. The pressure caused by the swelling can then lead to the appendix bursting. As the causes aren't fully understood, there's no guaranteed way of preventing appendicitis. Who's affected? Appendicitis is a common condition. Around 40,000 people are admitted to hospital with appendicitis each year in England. It's estimated around 1 in every 13 people develop it at some point in their life. Appendicitis can develop at any age, but it's most common in young people aged from 10 to 20 years old. Symptoms of appendicitis. Appendicitis typically starts with a pain in the middle of your tummy, abdomen, that may come and go. Within hours, the pain travels to your lower right-hand side, where the appendix is usually located, and becomes constant and severe. Pressing on this area, coughing, or walking may all make the pain worse. If you have appendicitis, you may also have other symptoms, including 1. Feeling sick, nausea. 2. Being sick. 3. Loss of appetite. 4. Diarrhea. 5. A high temperature, fever, and a flushed face. Diagnosing appendicitis. Appendicitis can be tricky to diagnose unless you have the typical symptoms, which are only present in about half of all cases. Also, some people's appendixes may be located in a slightly different part of their body, such as 1. The pelvis. 2. Behind the large intestine. 3. Around the small bowel. 4. Near the right lower part of the liver. Some people develop pain similar to appendicitis, but it's caused by something else, such as 1. Gastroenteritis. 2. Severe irritable bowel syndrome, IBS. 3. Constipation. 4. A bladder or urine infection. Your GP will ask about your symptoms, examine your abdomen, and see if the pain gets worse when pressure is applied to the appendix area, your lower right-hand side. If your symptoms are typical of appendicitis, this is normally enough for your GP to make a confident diagnosis. In this case, you'll immediately be referred to hospital for treatment. Treating appendicitis. If you have appendicitis, your appendix usually needs to be removed as soon as possible. This operation is known as an appendectomy or appendicectomy. Surgery is usually also recommended if there's a chance you have appendicitis but it's not been possible to make a clear diagnosis. This is because it's considered safer to remove the appendix than run the risk of the appendix bursting. In humans, the appendix doesn't perform any important function, and having it removed doesn't cause any long-term complications of appendicitis. If appendicitis isn't treated, the appendix can burst and cause potentially life-threatening infections. Peritonitis. If your appendix bursts, It releases bacteria into other parts of the body. This can cause a condition called peritonitis if the infection spreads to the peritoneum, the thin layer of tissue that lines the inside of the abdomen. Symptoms of peritonitis can include 1. Severe continuous abdominal pain. 2. Feeling sick or being sick. 3. A high temperature, fever. 4. A rapid heartbeat. 5. Shortness of breath with rapid breathing. 6. Swelling of the abdomen. If peritonitis isn't treated immediately, it can cause long-term problems and may even be fatal. Treatment for peritonitis usually involves antibiotics and the surgical removal of the appendix, appendectomy. Abscesses. Sometimes an abscess forms around a burst appendix. This is a painful collection of pus that occurs as a result of the body's attempt to fight the infection. It can also occur as a complication of surgery to remove the appendix in about 1 in 500 cases. Abscesses can sometimes be treated using antibiotics, but in the vast majority of cases the pus needs to be drained from the abscess. This can be carried out under ultrasound or computerized tomography (CT) guidance using local anesthetic and a needle inserted through the skin, followed by the placement of a drain. At the end, it is requested you to please subscribe our channel.